Hello students, I'm Dr. Pooja Chaudhuri, Associate Professor and Head Department of Physiotherapy, University of Science and Technology, Meghalaya. Today I'm going to discuss about pancreas, which is a topic in human anatomy in second semester, course code 201. By the end of this lecture, students will learn about the structure of pancreas, location, relations, blood supply, its nerve supply, and functions of pancreas. Pancreas is an accessory organ and exocrine gland of the digestive system, as well as a hormone producing endocrine gland. The pancreas is named for the Greek word pan, meaning all, and krias, meaning flesh. It is a 15 to 20 centimeter long organ which is present in the abdomen, and a J-shaped, soft, elongated, lobulated retroperitoneal organ which is located across the back of abdomen behind the stomach. Hence, we can say that pancreas is an endocrine and also a digestive organ. In this picture, we can see that the pancreas is a J-shaped organ, and also it is looking very soft and lobulated and light pink in color. Pancreas is made up of two types of glands, exocrine and endocrine. Exocrine gland secretes digestive enzymes, that is, the pancreatic juice. An endocrine gland secretes hormones, for example, insulin. Pancreas lies in close proximity to duodenum. Let's check the location of pancreas in the abdomen. Pancreas lies more or less transversely across the posterior abdominal wall at the level of first and second lumbar vertebrae. Let's see the parts of the pancreas. The whole pancreas has been divided into basically into four regions, that is the tail, the body, the neck, and the head. The head is again divided into two, that is head proper and uncinate process. In this slide, we will learn about the parts of the pancreas in details. And also we can check the location of the pancreas, as we have already discussed where it lies. Pancreas has 5 parts, which includes the head being the widest part of the pancreas, and it is lying in the concavity of duodenum. So this picture is showing us the head of the pancreas, which is very close to the duodenum. And we can also see the uncinate process, which is the projection of the head, which is arising from the lower part of the head basically. And it lies posterior to the superior mesenteric vessels. Neck. The neck is located between the head and the body of the pancreas, and it overlies the superior mesenteric vessels. And after the neck, we have the body which is centrally located and to the left of the superior mesenteric vessels. And the tail, which is touching the hilum of the spleen, and it lies within the close proximity to the hilum of the spleen. We can also see the tuber omental just over the body of the pancreas. Now we come to the shape of the pancreas. As we have already discussed that the shape of the pancreas is J-shaped, or we can say it is retort shaped, and it is set in the human body obliquely. So the bowl of the retard represents its head, and the stem of the retard its neck, body, and the tail. Coming to the size of the pancreas, it is 15 to 20 centimeter long. It is 2.5 to 3.8 centimeter broad and 1.2 to 1.8 centimeter thick, and it weighs about 90 grams. Now we come to the relations of pancreas. The head of the pancreas is enlarged, flattened right end of the pancreas, and it is, as we have already seen, that it is lying in close proximity of the sheath-shaped curve of the duodenum. The head has three borders and two surfaces and one process. So out of the three borders, we have the superior and inferior and light lateral, and two surfaces. We have the anterior and posterior surface of the head and one uncinate process. So in this picture, we can see how the pancreas is lying. The head is the superior border of the head. As we can see, it is overlapped by the first part of the duodenum, and it is also related to the superior pancreaticoduodenal artery. And the inferior border of the head of the pancreas is related to the third part of duodenum and to the inferior pancreaticoduodenal artery. And also we can see the right lateral border of the head of the pancreas is related to the second part of the duodenum, terminal part of the bile duct. Next is the two surfaces of the head of the pancreas, how it is related with. The two surfaces are anterior and posterior, and anterior surface, as we can see in the picture, is related from above downwards to first part of the duodenum and to the transverse colon and to the jejunum. So which is very much clear in the picture that is shown here. Next is the posterior surface relations of the head of the pancreas, and it is related, as we can see, in the back side of the head of the pancreas, where we can find the inferior vena cava, we can find the terminal parts of the renal veins and the right crust of the diaphragm and the bile duct. Next is the uncinate process. So just next to the head of the pancreas, we have the uncinate process, and this uncinate process now is related anteriorly. We have the superior mesenteric vessels, and posteriorly to the uncinate process, we have the aorta. So we can see the uncinate process over here and how the structures been placed anteriorly and posteriorly. Next is the neck of the pancreas, and this is slightly constricted part of pancreas between the head and the body, and it is directed forwards, upwards, and to the left, and it has two surfaces, anterior and posterior. So these are the relations of the neck of the pancreas. So we can see the anterior relations, and also we can see the posterior relations over here. And then we come to the next, that is the anterior surface as we have already discussed here. So we can check that the relation of the neck of the pancreas, anterior surface is related to the peritoneum and pyrolus, and the posterior surface is related to the termination of the superior mesenteric vein and the beginning of the portal vein. And next is the body of the pancreas, and it is elongated and extends from its neck to the tail. And the external features are it has three borders, anterior, superior, and inferior, and a part of body projects upwards beyond the rest of the superior border a little towards the neck, and this there is a projection as we had already seen before, and that projection toward the body was tuberomental. So we can check over here the tuberomental, which is present over the superior part of the body. Now relations, coming to the relations, it has three borders. The anterior border provides attachment to the transverse mesocolon, and the superior border is related to the celiac trunk over the tuberomental hepatic artery to the right and splenic artery to the left. And the inferior border is related to the superior mesenteric vessels at its right end. So this is giving the picture of the anterior and the inferior relations of the body of the pancreas. Now next is the body of pancreas, the relations, and we can see that the anterior border is providing attachment to the transverse mesocolon, and the superior border is, so we are talking about the body of the pancreas, and basically we're talking about the borders right now, the anterior border and the superior border and the inferior border. So anterior border is providing attachment to the transverse mesocolon, and the superior border is related to the celiac trunk over tuberomental, the hepatic artery to the right and splenic artery to the left, and the inferior border is related to the superior mesenteric vessels. And there are three surfaces: anterior surface, posterior surface, and inferior surface. The anterior surface is concave and it is directing upwards, and basically this anterior surface is covered with peritoneum, and it is related to the lesser sac and to the stomach, and posteriorly to the posterior surface is related to the aorta, the left cross of diaphragm, the left suprarenal gland, and the left kidney, the renal vessels, the splenic vein. And the posterior relations of body of the pancreas, the posterior surface, we have the aorta with origin of superior mesenteric artery, the left cross of diaphragm, the left suprarenal gland, the left kidney, the left renal vessels, the splenic vein. So we can see there are so many structures related to this pancreas, and this is giving us a clear picture of the anterior infiltrations of body of the pancreas, and really we can see it is covered by peritoneum and is related to the lesser sac and to the stomach. And the inferior surface, we can see that it is covered by the peritoneum and it's related to the duodenojejunal flexure and the coils of jejunum and left colic flexure. And the inferior surface, it is covered by peritoneum and related to the duodenojejunal flexure and also coils of jejunum and the left colic flexures. Now we come to the next part of the pancreas, that is the tail of the pancreas, and this is the left end of the pancreas and lying in the renal ligament with the splenic vessels, and it is coming in contact with the lower part of the gastric surface of the spleen. Next is very important part. So we have finished with the relations of the pancreas, and now we will check the ducts of the pancreas, which is a very important part of the pancreas. There is the major pancreatic duct, that is the pancreatic duct, or also called as the uh, duct of Wirsung. And basically this is a duct that is joining the pancreas to the common bile duct, and this is basically supplying the pancreatic juice that is required for digestion. So this the pancreatic duct is joining the common bile duct just prior to there's an ampulla of Vetter. So just prior to the ampulla of Vetter, this pancreatic duct is joining the common bile duct, and after that, both these duct they perforate and to the medial side of the second portion of the duodenum at the major duodenal papilla. And basically, this is lying in the posterior surface of the pancreas. So here we can check the papilla and also the main pancreatic duct. So this is how it looks like. This is a pancreatic duct, the main pancreatic duct, and this is the major duodenal papilla. And this area is called, just beside the major duodenal papilla, there is the ampulla of Vetter. And also we can check that this ampulla Vetter is now joining with the common bile duct, which is the part of the gallbladder. And as we can see that the gallbladder is embedded in the liver. As you already know, the largest, the second largest organ in the whole body, human body, is the liver. And the first largest organ is the skin, and the second is the liver. And if you check only with the abdomen, in the abdomen, the liver is the second largest. Sorry, the first largest. Now let's check uh, with another picture over here, which is giving us a much more clear idea how the pancreatic duct is joining the pancreas, and how it is basically it is giving the pancreatic juice, which is now helping us in digestion. So you can see that it is joining the bile duct just prior to the ampulla of Vetter ampulla. This is the major duodenal papilla. Okay, so basically it is joining the bile duct. Okay, just prior to the ampulla of Vetter, and after which both ducts will perforate in the major duodenal papilla. In the major duodenal papilla. Now we come to the next, that is the accessory pancreatic duct. Many people just have just one pancreatic duct, but however, there are some people who will be having an additional pancreatic duct, which is called the duct of Santorini. And this begins at the lower part of the head of the pancreas, and then it may open separately into the second part of the duodenum, and usually it drains into the duodenum via the minor duodenal papilla. And in the other 30%, it drains into the main pancreatic duct, which drains into the duodenum via the major duodenal papilla. So this is a clear version of what we have already discussed about the duct of the Santorini. It is beginning at the head of the pancreas. Yes, it is beginning at the head of the pancreas, right? And then it opens into the second part of the duodenum. Second part of the duodenum. So this is the accessory pancreatic duct, and then it is opening separately into the second part of the duodenum, and usually it is draining into the duodenum via the minor duodenal papilla, and in the other 30%, it drains into the main pancreatic duct, which drains into the duodenum via the major duodenal papilla. Now we come to the arterial supply of the pancreas, and it is supplied by, pancreas is supplied by Mainly it is supplied by the pancreatic branches of the splenic artery, and also there is other arteries that are, they are the superior pancreaticoduodenal artery and the inferior pancreatico artery. So basically the superior mesenteric artery, it is lying behind your the neck of the pancreas and the anterior to the uncinate process, and posterior to the neck of the pancreas, the splenic and the superior mesenteric veins, they join to form the hepatic portal vein. So this is the venous drainage we're talking about. So basically we have the splenic vein and the superior mesenteric vein and the portal vein. So here is the picture of the venous drainage of the pancreas. Next is the lymphatic drainage, and basically the lymph is drained from the body and the tail of the pancreas via the lymphatic vessels, and that empty into the pancreatico-splenic lymph nodes located along the splenic artery. So the pancreas is drained by this by the lymphatic vessel that will follow the arterial supply, and they then empty into this pancreatico-splenic nodes and pyloric nodes, and which in turn it will drain into the superior mesenteric and celiac lymph nodes. So this is how the lymphatic drainage flow chart has been showed over here. First, it will drain into uh, the pancreaticoduodenal lymph nodes, and then it will drain into the pyloric, pyloric, pyloric nodes, and then it will drain into the superior mesenteric nodes, and finally it will reach the celiac lymph nodes. Next, we come to the nerve supply, and nerve supply, basically the vagus or the parasympathetic splenic sympathetic nerve supply the pancreas through the plexuses around its arteries. These are the nerve supply. Now we come to the endocrine part of the pancreas. So the endocrine part of pancreas is basically made up of some microscopic element which is called as the pancreatic islets of Langerhans, and there are uh, basically these islets have different types of cells. Okay, they have the beta cells and the alpha cells, and these beta cells will produce insulin and the alpha cell will produce glucagon, and basically these they are important in the metabolism of glucose. So next we come to the functions of the pancreas. So as we already know, the pancreas aids in digestion, right? So it is releasing enzymes that digest fats, proteins, carbohydrates, and nucleic acids, and it is also producing alkaline fluid to neutralize the acidic kind in the small intestine, and also uh, it is producing insulin and glucagon to regulate the sugar metabolism. So as we already know that pancreas is a unique organ, as it is fulfilling both the exocrine and the endocrine roles. And it is clear from our discussion that exocrine will function, will include the synthesis and the release of the digestive enzymes into the duodenum of the small intestine, and these pancreatic juices, the enzymes are the pancreatic amylase, then pancreatic lipase, and the proteinase, and the nuclease. So this pancreatic amylase is breaking down the carbohydrate, and the lipase is breaking down the fats, and the proteinase is breaking down proteins, and nuclease is breaking down the nucleic acid into nucleotides. Patient. 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 So thanks for listening, students, for today's lecture. And there's a take-home message for you. Believe you can, and you are halfway there. Thank you. Have a nice day.